Which of the following is a known risk factor for the development of stroke during cardiac surgery with cardiopulmonary bypass, CPB? A. Use of aortic arch surgery. B. High serum cholesterol levels. C. Previous history of transient ischemic attacks, TIAs. D. Use of beta blockers in the perioperative period. Answer: C. Previous history of transient ischemic attacks, TIAs. Explanation: A history of transient ischemic attacks, TIAs, is a significant risk factor for stroke during cardiac surgery. Patients with TIAs have a predisposition to cerebral embolism or ischemia due to pre-existing cerebrovascular disease. Other factors, like high cholesterol or beta blocker use, can influence stroke risk but are less directly correlated with CPB-related stroke. What is the primary effect of hyperthermia during cardiopulmonary bypass on the brain? A. Increased blood flow to the brain. B. Enhanced protection of the brain from ischemic injury. C. Increased risk of cerebral ischemia and injury. D. Improved oxygen extraction by brain tissue. Answer: C. Increased risk of cerebral ischemia and injury. Explanation: Hyperthermia during cardiopulmonary bypass increases the risk of cerebral ischemia and injury. Elevated body temperature can lead to a higher metabolic rate and increased oxygen demand by brain tissue, which, in combination with reduced cerebral blood flow, can exacerbate ischemic injury. Cooling, or mild hypothermia, is typically used during CPB to help protect the brain. Which of the following is most likely to be used for real-time monitoring of cerebral perfusion during cardiac surgery with cardiopulmonary bypass? A. Transesophageal echocardiography. B. Electroencephalography, EEG. C. Near-infrared spectroscopy, NIRS. D. Arterial blood gas analysis. Answer: C. Near-infrared spectroscopy, NIRS. Explanation: Near-infrared spectroscopy, NIRS, is commonly used to monitor cerebral oxygenation and perfusion during cardiac surgery with cardiopulmonary bypass, CPB. It is a non-invasive technique that provides continuous, real-time monitoring of brain oxygen levels, helping to detect early signs of cerebral hypoxia and allowing for timely interventions. EEG and arterial blood gas analysis provide other types of information but are not specifically used for cerebral perfusion monitoring during CPB. Which of the following surgical approaches is most strongly associated with an increased risk of cerebral complications during aortic surgery with CPB? A. Insertion of a left ventricular assist device, LVAD. B. Proximal aortic arch surgery with aortic cross-clamping. C. Endoscopic minimally invasive approach. D. Coronary artery bypass grafting, CABG, without aortic cross-clamping. Answer: B. Proximal aortic arch surgery with aortic cross-clamping. Explanation: Proximal aortic arch surgery with aortic cross-clamping carries a higher risk of cerebral complications. This is because the cross-clamping of the aorta can lead to a reduction in cerebral perfusion, increasing the risk of cerebral ischemia, embolism, or stroke. In contrast, CABG without aortic cross-clamping and minimally invasive techniques may carry a lower risk of cerebral complications. Which of the following factors is most closely associated with a poor neurologic outcome after a cerebral embolic event during cardiac surgery with CPB? A. Younger age. B. Rapid removal of embolic material. C. Presence of pre-existing cerebrovascular disease. D. Use of high-dose steroids. Answer: C. Presence of pre-existing cerebrovascular disease. Explanation: Patients with pre-existing cerebrovascular disease, such as carotid artery stenosis or previous strokes, are at greater risk for poor neurologic outcomes after a cerebral embolic event during cardiac surgery. This is because their cerebral vasculature is already compromised, making it more difficult to compensate for the embolism and leading to more severe neurological deficits. Younger age, rapid removal of embolic material, and use of steroids are less critical factors in determining the neurologic outcome. What is the effect of low-flow cardiopulmonary bypass on cerebral perfusion in adult cardiac surgery? A. It significantly reduces cerebral oxygenation. B. It has no effect on cerebral perfusion. C. It enhances cerebral perfusion. D. It increases the risk of ischemia due to inadequate flow. Answer: D. It increases the risk of ischemia due to inadequate flow. Explanation: low-flow cardiopulmonary bypass, CPB, can increase the risk of cerebral ischemia due to insufficient cerebral perfusion. Inadequate flow during CPB may fail to meet the metabolic demands of the brain, particularly in patients with compromised autoregulation of cerebral blood flow, leading to ischemic injury. Proper flow rates are essential to maintaining adequate cerebral oxygenation and preventing complications. Which of the following interventions has been shown to reduce the incidence of cognitive dysfunction in the early postoperative period following cardiac surgery with CPB? A. Administration of sedatives in the intensive care unit, ICU. B. Early extubation and mobilization. C. Use of higher doses of inotropes to improve heart function. D. Intensive fluid resuscitation. Answer: B. Early extubation and mobilization. Explanation: early extubation and mobilization after cardiac surgery with CPB are associated with a reduced incidence of cognitive dysfunction. These practices help promote faster recovery, prevent complications such as delirium, and improve overall brain function post-surgery. Sedatives and inotropic support may be necessary in specific clinical scenarios, but they do not directly contribute to preventing cognitive dysfunction. What is the role of alpha-1 adrenergic agonists in preventing cerebral injury during cardiac surgery with CPB? A. They increase cerebral blood flow. B. They prevent embolism formation. C. They help maintain cerebral perfusion pressure. D. They prevent postoperative cognitive dysfunction. Answer: C. They help maintain cerebral perfusion pressure. Explanation: alpha-1 adrenergic agonists help maintain systemic vascular resistance and blood pressure, which in turn helps to maintain cerebral perfusion pressure during cardiac surgery with CPB. Proper cerebral perfusion is essential for preventing ischemic injury. While these agents are not directly involved in preventing embolism formation or cognitive dysfunction, they play a critical role in maintaining adequate blood flow to the brain. Which of the following is a common early sign of cerebral hypoperfusion during cardiac surgery with CPB? A. Sudden loss of consciousness. B. Increased intracranial pressure. C. Persistent pupil dilation. D. Decreased cerebral oxygen saturation. Answer: D. Decreased cerebral oxygen saturation. Explanation: decreased cerebral oxygen saturation, as measured by near-infrared spectroscopy, NIRS, is a common early sign of cerebral hypoperfusion during cardiac surgery with CPB. It indicates that the brain is not receiving adequate oxygen, which can lead to ischemic injury if not addressed promptly. Sudden loss of consciousness and increased intracranial pressure are less commonly seen as early signs, while pupil dilation may indicate more severe cerebral injury. Which of the following strategies is most effective in reducing the incidence of postoperative delirium, a common manifestation of cerebral morbidity, in cardiac surgery patients? A. Limiting postoperative fluid intake. B. Administering high-dose sedatives in the ICU. C. Implementing a structured early mobilization protocol. D. Using narcotics for pain management. Answer: C. Implementing a structured early mobilization protocol. Explanation: early mobilization is one of the most effective strategies to reduce the incidence of postoperative delirium in cardiac surgery patients. Structured early mobilization helps improve circulation, reduce the risk of complications such as deep vein thrombosis, and decrease the incidence of delirium by encouraging interaction and mental alertness. High-dose sedatives and narcotics can increase the risk of delirium, and fluid management is not directly related to delirium prevention.